I want to remind folks, I've said it every day, but again, it's important to note that we do expect to see an increase in cases day over day, week over week, and perhaps month over month. People have been asking me, when do we see turning the tide? And that's a difficult question to answer. We've looked at other countries and their experience, but every situation is different because it depends on the types of protective measures that have been taken and when they've been started. We are hopeful in this community that the type of measures that we have taken with the shelter at home order and the social distancing that we are continuing to recommend and enforce if necessary will in fact turn the curve, but we don't know when that will be. My best estimate is that we are looking at a minimum of weeks before we hit the peak number of cases, and it may be even longer. With respect to the daycare situation, there are a large number of first responders who we need to make sure that their children are taken care of so that they continue to work. So we've been working in concert with the school system, with the EOC, and with a number of other providers who are looking to stand up and are planning to do so this week. Child care for essential workers. I've received a number of questions, well, who is an essential worker? And in this regard, we are right now looking to only provide this service to the people who are actually fighting the disease. I know that the availability of childcare is a big issue for many sectors of our community, but we are providing this only for the people right now who are emergency responders to the disease at hand. We have put a call out to invite people who are either teachers in the system or otherwise do not have their regular jobs and may be available to staff these child care centers for these children of essential workers. And we're hoping that as many, especially those who are in the lower risk groups of young and healthy individuals, will make themselves available to serve that purpose. I do want to talk a little bit about the social distancing measures and the transmission of this disease. I think you've been hearing everyone now is an expert on 6-foot distancing. So why 6 feet? It is not a magic number. It is the average distance, if I can be graphic, that a cough or a sneeze generally goes in terms of the droplets. So that's why. That doesn't mean that someone passing through your 6-foot space is at risk of getting the disease unless you're actively coughing or sneezing on them at the moment that they do so. So we're asking for people to think about the infection control measures and adhere to this 6-foot distancing, but also not, we're beginning to see a number of calls where, hey, I saw people on bicycles that were less than 6 feet apart. What I've been saying throughout this whole epidemic is we are invoking all of these stringent measures to bend the curve, to bring down the curve, to limit the spread, but we are not anticipating that every fleeting interaction between human beings is going to be a source of transmission.